Right. So good night, everyone. I hope that everyone has been well and keeping safe in these times. If any visitors or guests with us tonight, my name is Jade Chattergoon, and tonight I'll be discussing the role of AI in the fight against COVID-19. So in particular, we will be looking at various applications of artificial intelligence, which played a role in fighting the pandemic. That is AI in prediction and tracking, AI in early diagnosis and contact tracing, AI in reducing strain on the healthcare system, AI in drugs and medicine, and AI in curbing the spread of misinformation. So within the past 2 decades more, the human race has forgotten their differences just for a little while and came together to battle a number of viruses that could possibly have wiped out the entire, well, if not entire, large portion of the human race. That includes Ebola, Zika, H1N1, and SARS, just to name a few. So as our technological world advances, each time we're hit with a pandemic, we find new ways to apply our technology to medicine and disease control. In the year 2019, the world saw its most recent outbreak, named coronavirus disease 2019. That's its official name, and then shortened as COVID-19, as we all know. And it is quite prevalent today, August 16, 2021. Is coronavirus disease 2019 the worst pandemic yet? How does it really rank up against some of the other infamous diseases? Now, ranking plagues and diseases is not as straightforward as you may think. In fact, Vox has claimed it to be a near impossible task. You can view their article via this link right here. Nevertheless, Vox has ranked COVID-19 as one of the top 10 deadliest plagues by assessing excess mortality. The Washington Post has named COVID the 9th deadliest. Our World in Data has defined excess mortality as a term used in epidemiology and public health that refers to the number of deaths from all causes during a crisis, above and beyond the death rate we would expect to see under normal conditions. So they were able to create this graph shown here. And this graph shows the excess mortality due to COVID-19 in the US by comparing deaths in 2020, that's this one here, right, against the average death rate in 2015 to 2019. So the death trend in 2020 is plotted in red, and we can see clearly this defined spike here representing the first wave, which occurred around the same time as our first wave in Trinidad and other countries around the world alike. So the highlighted black trend line here, right, shows the average death trend from 2015 to 2019. And I know many of you are thinking, why are we viewing US data and not Trinidad data? Well, unfortunately, our World in Data doesn't carry Trinidad and Tobago in their list of countries over here for this graph. So there are a number of ways that we can use data to help us understand and possibly treat, control, and gauge diseases. And now we have the ability to take it a step further and leverage artificial intelligence and machine learning for these purposes, none of which would have been possible at the time of the bubonic plague or the 1918 flu pandemic, for example. I like to think of AI as a superpower, so let's take the time to survey and appreciate the possibilities unlocked with regards to fighting COVID-19 with AI. So our first section is AI in prediction and tracking. The term prediction and tracking can cover a large expanse of research, and it provides a bounty of critical information. For example, COVID19projections.com is one of the many websites which are completely dedicated to sharing COVID-19 projections through the use of machine learning. Some of the applications include forecasting COVID-19 related deaths, infection rates, and recovery timelines. They're able to estimate and gauge vaccination rates and thus create estimates on human immunity to the virus through both vaccination and from natural infection. This assists us in understanding and estimating when society can possibly go back to living their pre-COVID-19 lives. Researchers have been able to scrape information from news sources and social media to develop early warning systems. They have been able to determine vulnerable countries and predict new outbreaks by geographical location to determine how COVID-19 is spreading and lend insight into why. All of these things are possible through the use of forecasting. According to the Radiological Society of North America, a study was conducted where researchers employed NLP algorithms to extract words from CT reports, which were then used to generate predictions for COVID-19. Results from this model were highly correlated to the official deaths and cases, and even assisted them in predicting a high rise in cases in certain parts of the US. The team, which includes AI experts, data scientists, and radiologists, continue to use forecasting models to gain insight on vaccinations and new COVID-19 variants. AI in early diagnosis and contact tracing. Other than staying virtually connected, helping us preserve our mental health, providing us with important information and news, our technological devices can bring additional benefits when it comes to contact tracing. One particular study developed a framework based on using smartphone embedded sensors to diagnose persons with COVID-19. US National Institute of Standards and Technology organized an event which pulled together many AI researchers from across the globe to leverage Bluetooth technology, very common in smartphones today, and combined with AI to determine if a person is standing or sitting less than 6 feet apart from an infected person for too long. And the name of the challenge was, if you can guess, the Too Close for Too Long challenge. The challenge focused on creating contact tracing apps that work using a combination of Bluetooth and data from various other built-in smartphone sensors. It has gotten a few mixed reviews since Bluetooth may not be the best tool for proximity detection, but a lot of people were also more comfortable with using Bluetooth rather than their location with GPS. If anyone is interested in checking it out, I have the link to the paper and link to many others I'll mention here today that I'll leave in a chat afterward, or I can share the doc. So another study, which Gabby spoke about in a previous CT Lab seminar, used merely a short recording of a cough, so as short as 2 seconds actually, to serve as a possible avenue for early COVID-19 diagnosis. A deep convolutional neural network was used to differentiate between COVID-19 and community-acquired pneumonia with exceptionally good results. AI in reducing strain on healthcare professionals. Now, if you've ever been to the ER pre-COVID pandemic, I don't have to tell you how extremely chaotic things can get for our healthcare professionals. Now, imagine this times 100, if you know, or maybe even more than that for the COVID-19 pandemic. Imagine, well, I like to imagine having to order equipment for a hospital in a pandemic and not having a clue of how to start or how often to order. That's just crazy. So researchers have developed several models with the goal of making processes more efficient and allocating resources optimally to aid our healthcare professionals. Triage is the assignment of degrees of agency to wounds or illnesses to decide the order of treatment for a large number of patients or casualties. And AI-based triage systems have been developed to automate many processes, such as imparting necessary training to health practitioners to maximize human resources. AI has also been used to determine treatment and mode of care using clinical data by using pattern recognition approaches. It has also aided in digitizing reports to reduce human contact with infected patients. Classification machine learning algorithms have also been used to classify patients based on the severity of their symptoms and even their genetic disposition. AI chatbots have been developed for remote consulting, thereby reducing the excessive crowding of hospitals, doctors' offices, and health centers, and preventing further infections from occurring. It has also helped determine patients most likely to require hospitalization after being tested positive, as well as help with capacity planning. Applications of AI in telemedicine can also monitor patients remotely by collecting audio-based data on patients quarantining at home. There are also models developed which can use this information to flag remote patients who may require hospitalization. Then there are service robots, as well as anthropomorphic robots with an AI core. Those have been developed to perform tasks such as cleaning, disinfecting, and monitoring in hospital environments. Surely, humanity has learned lessons from past pandemics and plagues, but we have also done a fantastic job with applying artificial intelligence for drug discovery and vaccine development. AI is being used to predict protein structures which allow virus entry and facilitate replication. For example, AlphaFold, a deep residual network from Google DeepMind, predicted protein structures for COVID-19, which catalyzed many drug discovery programs. Researchers have also used AI to screen highly reputable pre-existing drug combinations based on molecular descriptors and properties for the use of repurposing them for possible treatment for COVID. There have been a number of studies which have identified drug candidates which can be used to treat COVID. Some examples of these AI models for drug discovery are Benevolent AI, InSilico Medicine, PolyPharmDB, and then this one here that I intentionally did not say for fear of mispronouncing the name. We'll just call it Identifying Infectious Disease Combination Therapy with Artificial Intelligence. Aside from that, don't you think that the COVID-19 vaccines were developed in a remarkable amount of time? For example, and comparison, it took us many years before there was a breakthrough development of the Ebola vaccine. Meanwhile, here we are within 1 year of COVID-19 being developed as a global pandemic, and we have various COVID-19 vaccines to choose from. Did you know that as of December 2020, there were already over 200 vaccines in development? As a matter of fact, some potential COVID-19 vaccines were already in human trial stage of development within 3 months of the declared outbreak in China. We owe this lightning speed response time partially to AI. This also gives us hope for many years and for many viruses to come. Similarly to predicting those drug combinations I mentioned earlier, and the candidates as well, artificial intelligence was also here to predict vaccine candidates for COVID-19. Ong et al. Developed a vaccine reverse vaccinology machine learning platform which relied on supervised classification models. AI in curbing the spread of misinformation. When we first started hearing of this brand new sickness in China, the world started to go a bit crazy. I remember reading many different things on WhatsApp and hearing wild stories from people's conversations. And the internet was also just full of all sorts of posts and personal experiences, stories, and theories. It could easily incite panic into anybody. We must remember that living in a highly technological world makes us susceptible to a lot of misinformation. It's a very scary thing. This could be very dangerous and very confusing in a pandemic. There have been some non-AI solutions, for example, fact-checking websites, articles which debunk myths and rumors, but they haven't been the most efficient at actually solving the problem at its root. AI has been harnessed to identify trends as well as perform sentiment analysis to curb misinformation relating to COVID. Have you ever noticed on Instagram, for example, any post with COVID-related content triggers a small pop-up and a link to official information on COVID, its prevention, vaccines, all sorts of stuff. So that is AI at work. And once the post relates to COVID in any way, any viewer is literally presented with official and accurate information at their fingertips. And that is extremely important. Facebook put a mechanism in place for users to flag fake news. When a post is flagged by a large number of users, it appears less frequently on other users' news feeds, and it also appears with a warning. There's also a free app available on the App Store and the Play Store. It's not sponsored, called Logically, and it uses AI to verify content by sharing the article in question with the app. Logically uses NLP algorithms to rate the source of the article's credibility by 3 categories: low, medium, and high, and then the article itself as being reliable or unreliable. I wasn't able to find it myself on the App Store, but I did find a browser extension for Google Chrome. I can leave it in the chat after the presentation as well. Machine learning algorithms have also been implemented to highlight information on recovery rates, accessibility, and availability of healthcare. Apart from that, AI prioritizes latest information regarding evidence in treatment and diagnosis, which minimizes fear and panic, keeping the general public well informed. And while we have seen this implementation, which was used for good, many people have also expressed concerns about their data privacy. So if you think about it, social media websites constantly use your data to control what you see, and this is a powerful tool. Thankfully, in this case, we are provided with accurate news, world events, and information that has proven to be critical for our survival. Then we have a disclaimer on AI. I feel like this is something I have to mention, having spoken about all the amazing things that AI is capable of. You know, as much as AI has proven to be a lifesaver in many ways, we must remember that artificial intelligence is a tool for support and cannot or will not ever replace our healthcare professionals or their opinions and final diagnosis. We have to remember that there are limitations to AI, for example, with new variants. Whenever there's a new COVID-19 variant, it's almost impossible to know right off the bat how severe it is, how contagious it is, how it affects people in different demographics, or with varying underlying conditions, the symptoms associated, or any other information we could get from AI models that are trained on pre-variant data. AI requires large amounts of historical data to train on. With each new variant, unfortunately, there'll be a gap and possibly massive changes in patterns observed before. We never know. We should also note that the data used for some of these models can possibly contain bias, which implies that models are only at a certain level of performance after certain assumptions have been made. So I have quite a few sources linked here in the bibliography section. I wanted to cover as many applications as I could. So I know some of you will find some application particularly interesting and want to know more. Since I covered so many sources, it was difficult for me to go into full detail. So if anyone would like to access this Google slide doc, I have no problem with sharing this with you. So you could access the material through these links. You can share your Gmail address with me via a private message on the Zoom call, and I can add you to the Google Doc from there. So thank you for listening, everybody. And thank you for Slide School for the templates.
Yeah, thanks, Jade, and nice presentation. So
No problem.
is there anything here we could do locally in AI for COVID, because that's one thing we haven't been able to do, mostly because of lack of data.
Yes. Yes, that is definitely the problem, because I've been thinking since this pandemic started, this is the opportunity for AI researchers in Trinidad to show really the power of AI and what it could do, and really expose the public on, what AI can help with, what the importance of the data, but we've seen so many issues with the data in Trinidad so far.
Yeah, that's unfortunate. Even decisions that they made about vaccination centers and number of sites and all that kind of stuff, which is not really
Yes.
AI, it's more operations research type stuff. Yeah, it would have been good for us to be more involved, but yeah, data and yeah, that's the main problem. But thanks, nice presentation.
Thank you. Even I think the vaccinations, like some vaccines are will have more dangerous risks associated for different demographics, right? I was speaking to somebody today and they were saying, we could have done something to recommend what vaccines would be best for certain demographics, because I mean, a lot of people, I know in particular, the AstraZeneca is having some really, really adverse effects on younger people under 30. But a lot of them have to take that vaccine. So it's a big risk for certain people, and then certain people is not such a big risk. So at least I think maybe recommending which vaccine is for you based on your health data could have been something we could have explored a bit.